Here, as we talked about the female version, now coming to the male version, what are the specific causes in male which causes the poor sperm or quality or their causes in the men?
Very good question, actually. This is something which people need to understand. There are many factors, out of which environmental factors are playing a huge role nowadays.
How can one prepare when they are planning for the baby?
See, basically, very simple logic. Everything in the body is something due to what you do to it. There is a relation between the cause and effect, as I told you.
Namaste, everyone. I welcome you to Krishna Talks, the podcast show, once again with a special guest, as I always say. And today we are going to talk about a very important and a burning topic. And it is very important concern in the society as a whole right now. So we are going to talk about something very deep and need of the hour. So we have an expert accordingly. So this expert, she is a fertility expert. Yes, today we are going to talk about the nature and ups and downs in the fertility journey. So today we have Dr. Nandini Mhetere, who has helped many people conceive naturally without any medication. And her expertise is very deep. And to add more, let's welcome Dr. Nandini Mhetere. Ma'am, welcome to the podcast.
Thank you, Krishnaveni, for having me on your podcast. I'm blessed to be a part of your show so that I can give the message to the people who are in need of it.
Thank you for your valuable time. Taking time from your busy schedule and being here means a lot. And as we are going to talk about fertility, maybe many people may be waiting that what we are going to discuss. But yes, we are going to discuss about it. As we see the change in lifestyle, let me start as it is. There is change, lot of changes in the lifestyle, dramatic changes. That that also contributes to fertility. Nowadays, we see lot of issues in the society for fertility issues. We see more than the normal clinics. We see IVF and fertility clinics bombarding like anything. So let's discuss about how this contributes to the stress and hormonal effects in the couples, the person who is going through that, the female who is going through the treatment, and all that. And it's not about only the female fertility means people think it is female fertility. There is also other side of it, which is the male fertility also. So please throw some light on why is so much concern about the fertility and the production of eggs.
To be very frank with you, when I started my practice more than 2 decades ago, the fertility cases, what I used to deal with at that point of time, it has become at least 10 times more today. Because at that point of time, people used to have issues, but they were very smaller issues and it was easily rectifiable. But in the past 1 decade, that is 10 years, I have seen a lot of rise in the fertility issues. Basically, I can contribute this as a huge shift in our lifestyles and dietary habits, and as a whole, the how the couples are leading their lives. Even the working couples, the millennials, what we call, the challenges they face at their workplace, and so many other things which are very important contributing factors towards their regression in their fertility status. Uh, what I can tell is it is a combined effect of many things. It is just not one thing. It may be the diet, it may be the stress levels, it may be the lifestyle, it may be their sleep schedules, it may be so many other things which are interrelated. Uh, this is a very downward trend in the society. Very sorry to say that, but we can see the IVF centers just like any other chai
Yes,
tapris. So many IVF centers have come up. It is just like franchises of IVF centers have come up, which is not a good
yes,
thing, which is not a
not
good
the
scenario. Procreation is a natural process, and for that, people have to seek help now because of the challenges they are facing. So there are many things. And one more thing I would like to add is the aging factor. Nowadays, as you know, the females are also goal centric, job centric, career centric. And in this process, most of the time, without their realization, they lose out on the prime window of their
Yes.
fertility age. And then when they realize it's little late, they start panicking. And even that matters a lot, because having the right, timing is also very important, because biological
What
clock is
according
something.
to you is right timing? Like earlier, females used to get married earlier, maybe at the age of 18, 19, 20, 21 to 25. Now people start thinking of marriage after 25. So is it that that age factor also matters?
Exactly. I'm trying to make it a point that it is a societal difference now. Fertility
Yes,
issues are the result of our high aspirations and too much of affluence, you can call lot of good education system, and that leads to a lot of independence in the mindset of the women as well. I'm not telling it's wrong, it has to be
yes.
there, but they need to be also mindful that they also have a personal life as well, which is equally important to have the right onset at the right time as well. As you rightly said, when I get messages from patients, they are like getting married at the age of 32, 34, 35
Yes,
sometimes. And then adjustment with the spouse and then the family. Then you can understand there is a 1 decade shift in their fertility
yes, yes.
journey. And that is a huge thing today.
1 decade, 10 long years, it makes huge difference, right?
Yes, yes. Primarily, a female is very productive and very fertile in the age of between 20 to 32 or 35 years. That 15 years span is very important. So the more you delay, it's not that the older women cannot get pregnant. It is not that way, but it's better to have in that period, because the chances of having the challenges in their pregnancy, the problems in the children as to some genetic abnormalities and so many challenges, these challenges can be foregone if they have a child in the earlier age.
How much stress contributes to this delay in fertility? Of course, major part is played by lifestyle and diet. Second thing is the female who's going through the process of the fertility medications, the kind of stress, the kind of societal pressure she undergoes. What is the impact of that in the fertility
It
process?
is just like that. There, for everything, there is a cause and effect, right? It is, this is a vicious cycle. Fertility, not having a baby at the right time is causing stress, and that is causing more hormonal imbalance in the female, and again the hormonal imbalance is again causing her not to produce a right quality egg in the right way, and that also contributes to the uh, not having fertilization and going through the pregnancy. So stress is a major factor. Actually, it's just not during the fertility treatments, even the peer pressure, family pressure, societal pressure, and so many other things. And it is, as you just rightly mentioned, females are always looked upon as the torchbearer of the family, which is not true. We all know that for a child to happen, we need both the partners to be there,
Yes,
and you need a egg and a sperm for the baby to happen. But many a times now it is opening up. The acceptance is opening up, because even males have realized that. But primarily, when they visit the gynecologist, firstly the female undergoes all the tests, and of course, if they have been trying for a very long time, then the doctor will ask for tests for the both the partners. Stress, even in the career front, many other factors which are contributing to the stress definitely impacts the fertility, because everything in body depends on hormones. All the systems of the body, whether it is digestive system, whether it is respiratory system, whether it is any other system. So also your reproductive system. So for the hormones to have a balance, you need to have a peaceful mind. And for now, previously it was like stress debusters. Now it is called stress management, because we have to manage the stress. It is not like before. So stress also is very crucial, but then the more peaceful the couple can be, the easier it becomes. Of
easier.
course, it's easier said than done. It's not easy to be not under stress when their child is not happening on its own. But yes, stress plays a major role.
Here, as we talked about the female version, now coming to the male version, what are the specific causes in male which causes the poor sperm quality or their causes in the men,
Uh,
fertility causes?
Very good question, actually. This is something which people need to understand. There are many, many, many factors, out of which environmental factors are playing a huge role nowadays. Of course, with other factors like the structural anomalies in their reproductive system, genetic problems may be there. This percentage is very less compared to the other things. So in the environment factors, it is basically the impact of our pesticides, insecticides, microplastics, and so many other chemicals in our environment. Even, for example, the deodorant we use, if it's a chemical based, that can be detrimental to your health and also the sperm health. With or without our knowledge, we are inundated with so much of chemicals in our lives today.
Because
So that is having a major, because what you need to understand is sperms are very tiny microcellular structures which are very delicate, and that is precisely the reason the male reproductive system is designed by the God in such a way that the scrotal tissue or the testis, which is responsible for the production of the sperms, is suspended in away from the body, because very important thing here is the temperature at which the sperms are produced. So sedentary lifestyle may be one reason, because nowadays you see most of the new age couples are having something called, they are either into IT sector or some kind of jobs which needs them to be sitting in one place for a long time. So that
gadget
in
also contributes because we are surrounded by mobile phones,
yes,
laptops. That
yes,
also contributes in a way because if you see nowadays, mostly many people, especially men as well as women, they are confined to home, sitting and working from home, as you mentioned. So the visibility of in the vicinity when you have these electronic devices that does also affect men and female both.
yes, to a very large extent. The screen time what they are having for either it's for work or for recreation, whatever may be the reason. Nowadays, we cannot deny that we are completely dependent on the gadgets throughout our day and
Mm.
sometimes even in the night. So this is the excessive use of this blue light, which our bodies are exposed to. And before I forget, I would also like to mention that disturbance in the circadian rhythm, what we call, that is a day and night cycle, especially the IT sector, the men who are working, waking up throughout the night, even that plays a very crucial role, because there is one hormone called cortisol, which is a stress hormone, which is
Sure.
released only by waking up at the night. The more you delay in not following the nature's way of life, that is when to
That
sleep
is.
and when to get up. As
Mm.
Ayurveda says, Brahme Murti, we need to get up, at least if not by 4 or 5 o'clock, at least by 6 or 7 o'clock. The more you disturb the nature's signals, the more difficult for the body to work in a proper way. So this again is one of the stress factor, and this also can be a contributing factor for the males.
With the males. And for females, in addition to lifestyle, diet, there is also the imbalances in their thyroid, their what do we say, thyroid and PCOD also is an cause of fertility, right?
Yes, yes, to a very large extent. As I just told you, everything in the body depends on hormones. For a good quality egg to be released, it needs to take the signals from the gland called pituitary gland,
Yeah.
and especially in the females, there is a very beautiful rhythm of hormones at particular stages of our menstrual cycle. In the initial
Mm.
formation phase of the egg, and later on during the ovulation, and after the ovulation, during the implantation of the uh, fertilized embryo. So there are different type of hormones which need to be released in a pulsatile way, what you call. They have to be in such proper proportions in particular stages. So this is a very intricate and delicate interplay of these hormones. So
Mm.
this can be disturbed due to many things, and that becomes the reason for her not conceiving, and if at all she conceives, she may not retain the pregnancy. There may be miscarriages as well, or chemical pregnancies. There are so many things which are associated with this.
As you explained the process, how the eggs and the timing of the windows. those things matter in conceiving. Here, I want to ask you, how is how can one prepare when they are planning for the baby? How can one prepare for a better lifestyle? And how do you help people? What are the methods you apply and suggest to people so that they can conceive it?
This is a very, very interesting question, which I would love to answer because this is what people need to understand right now, that where they are going wrong and what can be done.
Yes,
See,
yes,
basically, very simple logic. Everything in the body is something due to what you do to it. There is a
yes,
relation between the cause and effect, as I told you. So, what you put into your body is very important. What is
very
your good health? It's a reflection of what you do. So, once you're having good health, it means your reproductive health will also be good. People tend to correct only one system, which doesn't work that way,
it doesn't work.
actually. This is a very, kind of I'm not getting the right word. People usually tend to slip it in such a way that uh, it's an ironical situation wherein they think that we can treat one thing and everything will be
One
fine.
thing.
No, it's not so. It's a reflection of it. So while on the fertility journey, just a couple of things need to be corrected. First of all, the first basic thing is their diet. Today, nowadays, most of the couples, uh, I mean, it is not, I'm not against them for eating outside food and all that. It's okay to have enjoy that once in a while. But what I see is I have seen the trend wherein they don't cook the meals for, consecutively 3, 4 days and they keep ordering the food from outside, especially if both the partners are working in the cosmopolitan
Yes,
cities. So what
yes.
goes into your body is very important.
And nowadays, the quick deliveries have added more
Exactly.
tempting for the people to order, right?
So actually the process of preparing the food, what kind of, the protein intake, how much of carbohydrates you are eating. It's not that you have to measure everything. A completely balanced Indian
And
meal itself is okay,
hmm,
but it should be homemade as far as possible. And a good intake of fruits and vegetables is recommended. And when it comes to lifestyle, if you're into any other substance abuses like alcoholism or cigarette smoking, in of course this is not only pointing out to the men, even the females smoke nowadays, you know that.
my next question was related to this only. How does these things
Yes,
affect in the quality of sperm and the production of eggs?
they
Because
they
if
are
somebody is more addicted to alcohol or something, does that affect in the embryo?
yes, to a very large extent. If it is occasional social drinking in a small quantity, it's fine. But if you
Hmm.
are into heavy binge drinking kind of thing, that also affects your, sperm health and the egg health. But the most important culprit beyond that is nicotine. That is
Yes.
tobacco, that
Hmm.
smoking and all that. Even the secondary smoking can be a reason for implantation not occurring, fertilization not occurring. What happens basically is when your body is exposed to all these culprits like nicotine and all that, the actual health of the sperm and egg is deteriorated. This is
Hmm.
called free radical damage in medical terms. So when you are looking towards a good conception in the journey, you need to have a good quality egg and a good quality sperm. So when you are working exactly opposite to the health of that particular sperm and egg, then you can understand what will be the outcome. Even if there is fertilization, if the baby happens, it may not retain completely 9 months. There may be genetic problems. There is something called epigenetic changes which happen to the sperm health or the egg health during our lifetime. It is not something which we carry. Genetic is something we carry. This is epigenetic. This is something we do to our body on a day-to-day basis. So the best way is to eat clean, eat homemade food, eat healthy as far as possible.
You're giving tough suggestions to people who are watching. It may look simple, but nowadays this is called the toughest thing to follow.
So the one question you asked me, the simple answer is get back to the basics. Just that
Yes,
way. Get back to the older ways. Just that.
all the ways.
That is enough. And also, when it comes to lifestyle, Sleep at the right time, get up at the right time, and do your routines. That is one thing, because sleep is very, very important for the repair of the cells.
Hmm.
Anything, any medication or any help you are taking from any specialist, that will only work if your routines are in place. Because as I told you, hormones are very important, and hormones depend upon your.
Nowadays, good sleep itself is a big concern because a lot of people are facing insomnia. But that is also another concern. So,
So just like you and me, there are sleep experts as well nowadays.
yes.
People who can make you sleep at the right time. So that is
Hmm.
making right conscious decisions. That's what people need. So
Sometimes we see people do a lot of workouts these days, in the process of becoming fit, they do a lot of workouts in the gym. Sometimes, isn't it that heavy workouts also a cause?
see, if it's heavy, high intensity workouts, I would really not recommend it too much. Um, for precise reason that otherwise also it is not so good. That may lead to
Otherwise,
some,
also. Okay.
yeah, that may lead to
Hmm.
some cardiac issues and all. Moderate, mild to moderate workouts, and especially when you, I just wanted to add to this, the people who are into sedentary kind of work, especially those IT sector and other so many other professions which need you to which needs you to sit in one place and work for a long time. Those people are also found to have higher BMI and more weight, obesity and overweight. So it's good to have the exercise regime in their life, but very high workouts is something which I don't advocate.
Hmm.
Just as I just told you, for other reasons as well. So because that is something which is needed for somebody who is pursuing it as a profession. It's not for these couples. They can only go for moderate, mild to moderate exercises or yoga. Some fertility friendly exercises are there. Fertility friendly yoga poses are there for both females and males. You can just take help of those yoga experts or exercise trainer to do those specific
As you
exercises.
said, that not so who are not so much professional for a couples who normal exercise is fine. If somebody just before marriage who is into bodybuilding nowadays, we see there is a lot of craze in the youngsters to do bodybuilding. When they do intense work at that time, does that also affect post marriage?
Actually, this is a very, very interesting question. I would like to give an example of one of my patients I met some 2 months ago. Bodybuilding by itself is not
Yes.
detrimental, but the
Mm.
supplements and the proteins and all those
So
extra things which they will add in the process, if you are not doing any of those things, it doesn't affect.
then,
But
okay,
what I see is there is a tendency of using so many
so many
anabolic
supplements.
steroids. Steroids. There are
Yes,
steroids in these
steroids. Yes,
protein powders and so
and
many
people are
supplements.
crazy and they feel happy in doing it.
Yes, because of their external appearance, that validation they
Yes.
get from the society by having great bodies to show off. That's good thing, but please don't use any supplements or any kind of protein powders or any other things without complete knowledge of it. What is the chemical composition or what goes into the preparation of that? If you are only certain of that, then you can buy that, because it has been heavily promoted by all these gyms and all those things. I was very, very surprised to see some reports of some people who have been using them and they turn into becoming azoospermic. The sperms itself, they themselves disappear from their body. It is that much detrimental because they would have been on those steroids for more than a decade at least. Because this process takes a while for the bodybuilding. It's
Right.
not one day thing. It will take a couple of
It's
years.
a
So they
yes.
become dependent on those things without their knowledge. And once finally, when they want to start the family, it's a shock for them as well because they wouldn't have been educated on that front at all. So,
You said that female is held as a torch bearer of fertility. So when it comes to men, when people come to you and you counsel both of them as a couple, have you seen any hesitant in men to come forward and do the tests or understand that it can be the male fertility issue also?
nowadays, thankfully, due to the media, due to the access of internet and so much of technology being around, Thankfully, it has educated the people in a better way. Now the hesitance, which used to be earlier, has come down, and now the males are equally equipped to take up the test and do whatever is required, except for a very few cases who are not very cooperative. So, but on a scale of 1 to 10, now the acceptance is better. It's at least 7 to 8.
And out of 10, how many cases you have as such wherein the male fertility is getting achieved?
This is a
Some
very
example if you can quote.
yeah, this is a very scary thing to answer to me. It is almost equal at par to the female cases nowadays. In some cases at least, there are both the things which you need to rectify. The female must be having PCOS and the male must be having some kind of morphological or motility issues in their sperms. So it is
Mm,
50-50 nowadays. It's almost similar.
mm,
Both
almost similar.
both the partners are equally involved nowadays.
Mm. As a couple, how do you educate them to somebody who is coming to you before planning? How do you educate them? What are the things that they should take care in terms of diet and their lifestyle? Some important things.
As I mentioned few minutes back, it is just go with the simple way of living as much as possible. And even I have attended some cases wherein, as a premarital test, they run the test and then get married to
Yeah.
see whether they are in a position to have a family later on. Even that is happening nowadays, and it is not wrong as well. I completely acknowledge that. But when they are in the fertility journey, what I advocate is looking to the today's scenario with the amount of fertility issues in such a big, percentage. I would really recommend not to go for family planning. Whenever
Mm.
it is happening, let it happen because uh, what first of all the marriages are late. Secondly, if again you're doing the family planning and then weaning off those medicines, and then your body is not cooperating, and then again running from pillar to post to get the conception happening. This is the trend I have seen.
Trend,
Initially,
yes.
in the first 2-3 years of marriage, they are not concerned at all, and once they are like
Later,
like it's a getting up from a deep sleep. They will one fine day they say, "Oh no, we have to start it. It's getting late," and all that. So what I see is people are trying to micromanage everything nowadays. Micromanaging career is okay. Micromanaging home is okay.
is it the fear of responsibility or the carelessness? How do you take this?
Uh,
Delaying.
no, the thing is they want to have a piece. I mean, they want the cake and have it too. They want affluence in all the areas of life. People are not
Mm.
ready to sacrifice anything.
Sacrifice. Yes.
They want to have the best of the best lifestyle,
But
enjoy
nothing comes easy, right?
enjoy everything, even the recreational drugs, what you call. I mean, the marijuana, whatever. So many things. They want to have a taste of everything. And
Mm.
eventually, if it is bouncing back on their health and not able to procreate, they are even not hesitating to take IVF route also. But mind it, IVF is not the answer to the conception. It is just a
Conception, yes.
yeah, it is just a technology which can help you to produce an embryo in the laboratory setting. But nothing can compare that to the natural conception because the rate of success of IVF is such a big question. It is
How
not.
do herbal, in this context, how do herbal medicines help in conception and fertility? Things like Ayurveda or Siddha medicines, basically Ayurveda. Now, a lot of people turning to Ayurveda for many of their ailments, and one of them being fertility. How does that help?
Actually, the beautiful thing about Ayurveda is Ayurveda deals with the basic root cause of the problem. If the
Mm.
female is not ovulating in the right way, or the male is not producing a right quality sperm, the Ayurveda principles are such that they advocate to going into the root cause of those problems, and then there is something called a detoxification protocol, which can flush out the toxins from your body, which must have affected your ovaries or the testes at some point of time, and then start producing them in its own way. So there are some amazing herbs, and the best part is they don't have side effects.
Hmm. Hmm.
So that is because in the conventional medicines, anything you take to rectify your fertility
Yes,
status have
it
got
has a side effect.
some or the other side effects, which are not highlighted, but they are very, very dangerous ones.
Hmm. Hmm. So in this process, when the IVF, apart from the medicines, herbal things, when the IVF thing comes up, how are the couples prepared to undergo that process?
See, whether it is natural conception or IVF or IUI or any other artificial reproductive technique, what the basic thing which we cannot change is the rule of nature. That is, what you need for a baby to happen is a good quality sperm and a good quality egg. So, whether it is natural or through the IVF route, when you are able to work on your body to produce a good quality egg and a good quality sperm, the product of both leads to a healthy embryo and it leads to a healthy baby. So, if you are undergoing even the IVF process, it is wise to improve the quality of the egg and the sperm before going to the IVF route to enhance the success rate of IVF.
What I
And
understood is going back to the basics. As you said, you have to take care of your body, natural food, follow the lifestyle, not the fast lifestyle, not the fast food. Go back to the basics as 10, 20 years before, how the food used to be. Nowadays, everything is adulterated, everything is processed. When you go step into your kitchen, you see all those processed foods and other things, packaged foods. So you have to keep your environment also away from that.
exactly. Because all these, whatever ready to eat foods or the packaged foods or the processed foods, or to, for that matter, what we order from outside, they are not mindful of what is going into it. There may be heavy influx of preservatives in it. For
Yes.
example, the whole Chinese model of food, whatever they enjoy, is
Mm.
something which is not palatable, which shouldn't be eaten at all. Because of the
Mm.
amount of preservatives they go into the sauces they have, they use in that. And without the sauces, it doesn't taste.
Different variety of sauces and so tempting for everybody to have those Chinese sauces. So you're asking people to stay away from that to
At
take
least,
care of your health and your future generation.
at least for during the fertility journey, if at all they are very much conscious of having a baby without the challenge of going through the artificial route.
Hmm.
This is very simple. Like 6 months, 3 to 6 months, if you can wean yourself out from all those things and then start leading a good lifestyle, and then you're able to have your own baby, what can be more better than that? Because I have seen cases wherein, due to not having a proper quality eggs, the females are suggested to go for donor eggs, which is not their
Hmm.
own
Yes.
biological child as well.
Hmm.
So it is so painful. So why
So
not?
many different type of cases coming up nowadays with the time
Yes, very true. People, and the worst part is, people are not able to realize that where they are going wrong. They
where
think
they are
that they're
going,
doing everything right, but why the things are not happening.
wherein they are doing everything wrong, which they are not realizing in their daily lifestyle.
Yeah, before I forget, one important thing is nutrition plays a very important. The right nutrition, what goes into your body, is reflected in your reproductive system.
Give
So,
us some examples of right nutrition as per.
see, for example, very simple example is the way the food is cooked. For
Hmm.
example, the protein sources, the non-vegetarian sources and the vegetarian sources. Non-vegetarian is the chicken, meat, fish, and all that. Vegetarian sources are lentils, pulses, legumes, and all
Yes.
that.
Yes.
You must have heard about the halal kind of meat.
Yes.
That is one thing. And deep fried, hamburgers which have meat. There are so many
Hmm. So many.
variants of meat which are heavily processed, and that is laden with saturated fats.
Hmm.
So the whole idea of that protein going into your body is
Feels
completely
feels
negated,
completely
right?
negative. Yes.
So the thing is, minimally processed foods, minimally cooked, minimally. I mean, whatever is there in its original form, you have to eat it in that form only. The more you try to mess around with that, it is not going to have the nutrient requirement as per your body.
Mm.
And as far as possible, try to use organic produce if you are able to have
Organic.
an access towards it. The
Mm.
vegetables, the fruits, the whole grains, everything. Just try to have the organic produce if it's available in your vicinity. So a balanced meal of good source of protein, carbohydrate, fat. When it comes to fats, you have to be very careful again, because in most of us, including Indians, are very fond of having lot of oil in our food, which is
Yes.
not which is not a welcome thing.
Fried
So
foods, oily foods,
yeah,
that becomes their favorite dishes, right?
yeah, and also burnt out meat, what we call, when I told of halal and all that, that is a process marination and it's charred almost, it's in the tandoor and all that, right? So it loses its own nutrient, absorption capacity altogether. So
Mm.
the basic thing is, how much ever possible, eat the food in its original form, not to make complete different dish out of it, wherein you cannot even recognize what it is made up of.
Have you come across any, you have so many success stories. Just to ask you one of those, have you come across anybody who has been very lost in their hopes and have come to you and you were able to help them conceive naturally with your ancient, bringing
Yes,
back to basics type
many
of a
of
things?
many of them. Just I'll highlight a couple of them. There was one case, a patient I dealt with. It was around 13 years back. He was a doctor himself. He was a doctor of
Mm,
Ayurveda himself.
mm,
Masters. He has done MD and he's a professor in a college. And he was not able to conceive for 5 years after the marriage. And his reports, and the interesting part was, he was not a smoker. He was not into alcohol, but still, for some reason, his sperm's parameters were completely disturbed. So to say, his counts were less, his motility problem was there. See, basically, when it comes to sperms, there need to be three factors which are very important for a conception. The count should be good, ideally, whatever is recommended by the WHO, and motility should be in certain percentage, and morphology, what you call the structure of the sperm, should be
sure.
normal.
Yes.
These three parameters are important for a conception to occur in a normal, natural way. In this person, all the three parameters were disturbed, and he sought my help, and I just put him on all the protocol which I use. It is a combination of Ayurveda and nutrition, because I'm basically a doctor of Ayurveda, and also I have a
Mm.
doctorate in nutrition. That is my qualification. So I combine both the sciences and make the patients have the right environment to have a a healthy baby. So this was one case. Within getting into holistic protocol, within 5 months, 4 to 5 months, he could get the success, and his wife's reports were normal. Only he was having, this is a male factor case. And one more very recent case is this lady. She was not from India, she's from outside India. She contacted me when I started my online journey. She had multiple IUI failures. She had conceived once and miscarried naturally. She had 2, 3 IUI, that's artificial insemination, what we call. Those failed. And she had immature eggs. That was the reason. She was refused IVF. She she went for IVF, but because the egg quality was not good, she was sent back home. That we can't do
Mm.
IVF, and she got into holistic protocol, which I advocate. And within 3 months, she conceived naturally. After trying for 3 years, she
So
was
happy you felt after that.
yeah, she was very happy. And this is very much possible, as I just told you. It is just that you have to bring back your body rhythms to normalcy, and that is very much possible with dietary modifications, little bit of exercise, and educating them, counseling them, stress.
Nowadays, basically, what's going wrong is the dietary
Yes,
food habits, which is going wrong for everybody from age 5 to age 50.
to a large extent, yes, you're true. And then, yeah, this is one case wherein, holistic approach helps both with a male factor as well as a female factor. What I see is
Why do
there is
you
a,
think the awareness about these topics, these things is very, very less? People are not open to talk about it. They keep it to themselves. Then again, stress and tension adding to their present issues. So why is this not so much people are aware of? They are hesitant to talk about it.
yes, precisely because it's a very personal thing, to be very honest. And secondly, though we have become so modern in all our other aspects of life, this one thing remains very, very personal. Of course, not in all the societies, but in many societies, it is still a very personal thing. And especially when you realize that you are having some abnormality in your system, whether it is for male or for female, it becomes a taboo subject for them because the family would have been questioning them and they're not able to answer them anything.
Answer.
And in many cases, I have even seen that even the male must be responsible, but the female tries to keep it a secret from the family so that his ego is not hurt. Because what they think is they don't
Societal
take
pressure comes in.
they don't take fertility problem as a disease. They think it as as a role of masculinity. That becomes a very that as you know we are
It
more
hurts their
into.
ego as well. Yes.
Yes, as you know, we still have this kind of male at chauvinistic attitude that can be compromised. So they are a little bit reluctant, and they try to keep it under the carpet for a long time. They keep consulting the doctors, not getting results, and finally, when nothing works, then they will just reveal it to the family that we are under such and such process. So yet we have to come out of this, mindset that fertility issues just like any other disease. It
Thank
need.
you for coming live and taking up this topic for discussion live so that people can know about what is happening, why it is happening, where they need to change themselves. What is it that they know that they are doing everything right? Where is it that they are doing wrong in their everyday food lifestyle, food as well as lifestyle?
Yes,
How
very
would you
true.
summarize the whole fertility journey to the people or the young couples who are watching, who are planning for their future babies? Your advice to them?
What I would say is enjoy life as it comes. Don't try to micromanage everything. Just like you micromanage your closets, your gadgets, your kitchens, your careers, don't micromanage your fertility journey because this is something which has to happen on its own.
Minutes.
When I see people, taking the medication for ovulation and even timing their intimacy with the partners and not happening, that what it means is you're trying to meddle with the nature's way of doing it.
Nature.
So just stay cool, stay put, relax yourself, enjoy life, eat healthy, be happy, sleep in time. You of course, using gadgets cannot be avoided, use it but in
Yes.
moderation. But then most important of all is do not miss your exercises. Make it a habit to exercise at least 5 times a week or 4 times a week. Some yoga, some exercise which is very important for the microcirculation. How much ever medicines you take, if it's the nutrients are not absorbed, there is no point in taking so much of medicine. So it's just like go with the flow. And if you're already married a little late, don't plan your family, just let it happen with the flow. That is one thing. And seek solution with the right provider, and don't hurry up in this race of IVF. If it's a very dire situation where nothing works, then it should be the last resort. It's not that I've seen some cases wherein they will say, okay, no, now we'll age. Our children will be of such and such age when we are 60. So let us have it. Let us go to IVF. It is not that way because
It is not.
IVF success rate is again very, very dicey. It's not in our control. So it's better to have a natural conception as much as possible. And as a last resort, if nothing is working and if you have very, very difficult problem which cannot be treated otherwise, then you can opt for it. And of course, as holistic approach has got beautiful solutions without you going through all those painful injections, hormones, and all those heartbreaks of the IVF. You just go with the natural flow and just try to be with each other, and things will happen. That's it.
Thank you so much, Dr. Nandini, for coming here, taking your valuable time and sharing so much on a sensitive topic and most important topic at the need of the hour in the present lifestyle. And hopefully, the audience have got to learn something. They must have got something to think about who are the newlyweds or who will be the future parents. Thank you, everybody, for watching this wonderful podcast. I'll be back again with another special guest with another special topic. If there is anything, any special topic which you as audience want me to bring in and discuss, please write in the comments. I will try my best to get the expert in that field. Thank you so much for watching it. Namaste.